Good afternoon. Welcome to the daily briefing at St. Clair County EMA, where Sam Behrman is with us today and has got some numbers for us. Welcome.
Thank you. So as of today, we have tested 5,170 St. Clair County residents with 926 positive test results, which is an increase of 21 from yesterday. And that includes both males and females from under 10 years old up to their 100s. We are at 4,183 negative test results with 61 results still pending. And we do have some sad news to report today. We are reporting 2 additional deaths, which brings St. Clair County total up to 71. Both are females who were in their 90s, and they both did have underlying health conditions. And as always, our thoughts and prayers go out to their families. As far as IDPH required 14-day quarantines that have been completed by St. Clair County residents, we are at 524. And for state totals, we are at 642,713 that have been tested, with 100,418 positive test results, which is an increase of 2,388 from previous day. We are currently at 4,525 deaths for the state, which is an increase of 146 from yesterday. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we have 64 patients that are currently admitted due to COVID-related reasons, and 3 of them are on ventilators. Before we do our updates for our congregate living facilities and long-term care facilities that are in outbreak status, a few points that I would like to remind everyone that these numbers are a running cumulative total. So from the very beginning, when one of these facilities reached outbreak status, which we've gone over before, but that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. Once they hit that status, they will be updated and they will stay on the list, so it's a running cumulative total. And we did have some discrepancies in 3 of our long-term care / congregate living facilities yesterday. I have spoken with each of those facilities, their administrator or their director, and we have cleared up those numbers. And I will make sure that I let you know what those numbers are when we get to those specifically. For Brea of Belleville, we are at 23 cases and 2 deaths. For Brea of Cahokia, we are at 8 cases and no deaths. Yesterday, for Caritas Family Solutions in Belleville, we had reported 18 cases and no deaths, but corrected today, that is 7 cases and no deaths. For Colonnade Senior Living in O'Fallon, yesterday we reported 5 cases and no deaths, and the corrected number is 4 cases and no deaths. And the final one that had a correction was Four Fountains in Belleville, and we had reported 109 cases and 17 deaths, but the correct number is 106 cases and 18 deaths. Help at Home in O'Fallon remains at 5 cases and no deaths. Knollwood Retirement Center in Caseyville is at 6 cases and no deaths. Lebanon Care Center in Lebanon is at 51 cases and 9 deaths. Memorial Care Center in Belleville is at 43 cases and 5 deaths. New Athens Home for the Aged is at 4 cases and no deaths. St. Paul's Home in Belleville is at 10 cases and 4 deaths. Swansea Rehab and Care Center is currently at 5 cases and no deaths. And TDL Incorporated in Belleville is at 4 cases and no deaths. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So, the reason for some of these corrections, we try to get you the most updated information all the time. Numbers are coming in, right before we do this program a lot of times. So, and I know at least with Caritas, the numbers, the 11 we reported yesterday, they were asymptomatic, not symptomatic.
Correct.
And that's why they went off the list today because...
Correct. And there was some miscommunication when those test results were, well, I shouldn't say results, when those people were tested. The information funneled down and it was turned out that they were not symptomatic. So we do not count people that are not symptomatic. And that's why it was important for us to reach out to all of those directors and administrators today and make sure that we had those corrected numbers so we had them ready for today's EMA briefing.
Well, we appreciate, that's a lot of work. You're trying to reach people. Of course, they're busy too.
They are, yes. All of these facilities are are running, on low steam just like we are. So, trying to catch them sometimes is hard, but trying to catch us at our desk is sometimes hard as well. So.
We should all be so lucky as to have low steam like you guys.
Oh gosh, I don't know. Coffee and Dr. Pepper. That's what's getting me through.
Well, Sam, I think it's worth mentioning too, at those nursing homes, those long-term health care, some of the staff that have been affected, they're working with reduced staffing. So
They are.
Today you may talk with somebody that's filling in for that person. So
Exactly.
But I'm glad we were able to get the corrections made, and we appreciate that.
And that's our priority, is to get, the most up-to-date correct numbers out to, those that are watching this briefing. I mean, we take a lot of pride in that at the health department and having correct and accurate information. So we're happy that we were able to do that and get the correct numbers out to everyone.
And we know that's what you are looking for, are correct numbers, and that's why we don't hesitate if we find out one of our numbers, like some days the zip code goes back down. We're going to just tell it like it is. Here's the number that came in. What you see here, these are the facts, and that's what you're going to get.
Yes.
So, and the good news, the COVID hospitalizations went down a little bit today, or did they?
Well, we were at.
Oh, let's see. They went up a little
64.
bit. Oh, they went up to
2. We did.
Nice
get
job, Sam. Well, anyway, we're still, with the two regions, the southern regions are 4 and 5. We're still making those metrics, and we know the governor did talk today about going into phase 3 and some things that they're looking at to maybe make opening up even more palatable to people. So we'll be talking about that tomorrow. The governor just got done with his briefing, and we'll sift through all that information, and we'll be reporting a little bit of that tomorrow. So we're going to add a new zip code today. And remember, in our zip code reports, if you don't hear your zip code, it doesn't mean that you don't have anyone who's COVID positive in your zip code. It just means that number has not risen above 5 yet. So the first zip code is 62201, and it remains at 13. 62203 has an increase of 4 to 34. 62204 is now at 36. That's an increase of 1. 62205 is 39. That number remains the same. 62206 is 86, and that number rises by 3. 62207 now has 62. That's an increase of 4. 62208 has 54. That's an increase of 3. 62220 is now at 100 with an increase of 2. 62221 increased by 1 to 79. 62223 remains at 44. 62226 remains at 110. 62232 remains at 15. 62239 is static at 11. 62243 increases by 1 to 7. 62254 remains the same at 28. 62257 remains the same at 7. 62258 remains the same at 14. Our new zip code today is 62264, and they're reporting 6 COVID positives in that zip code. Once again, 62264 has 6. 62269 has 63. That's an increase of 1. And 62285 has 8. That's an increase of 1. So those are the zip codes. Those are changing all the time too. And today, adding one isn't what we want to hear, Herb. But we continue to know that with more testing, that's what we're going to have. We're going to have more areas that show that virus is out there that may not have been detected before.
Well, and that's the thing, we stress all the time for more testing, and we know those numbers are going to go up. We've said that from day one. We had 21 more here in the county that Sam reported today, along with the sad news of 2 new deaths, 146 deaths across the state. I mean, we're still in it, but the numbers, as you said, the metrics that we're wanting to meet are staying right where we need to be. That was part of our conference call we had a little while ago with IDPH. I'm looking forward to going back and digesting that information, so see what we can look forward to in the next 9 days of that phase 3. Hopefully that's going to be spelled out in there. We had a conference call also with our state 911 administrator and other agencies, our weekly call with them. I also want to give a shout out to Sheriff Watson and his lovely wife Janice and Mayor Kupski. They went down to the JJK Center, took a tour of that, and while they were there, they got their test taken, and they said that we could mention that on the briefing today because the sheriff's wife is a faithful follower. She sets her clock for the briefing every day, so we appreciate that, and spread the word to go get tested. That's a good thing. We had 55 agencies pick up PPE equipment today. And I think Sam, she didn't mention it, but she got a pretty good shipment of PPE in today.
I did, yes, and we're very excited. We've inventoried it and organized it all, and we will be doing a push out to all of our long-term care facilities in St. Clair County to be able to provide them some additional PPE.
And that's good. And then we're expecting shipment here at the EOC tomorrow. So the PPEs are coming in, and we can't thank you, Chairman, and the legislators for keeping those coming in because we're able to fill those needs through our first responders in the long-term healthcare facilities. We've even had a couple of the local dentist offices call us now because they're able to get the supplies through us. So we're able to take care of them. So you've heard the numbers, and I want to thank each and every one of you who follow us. The numbers are staying where we want them lower, but people doing social distancing, good personal hygiene, that's what we want. Yeah, we want to get moved into phase 3. We heard some of the conference call with the press conference with the governor. We're anxious to get off of here and listen to that and then see what we can maybe talk about tomorrow. So we'll be back here momentarily with Daisy to translate this into the Spanish communities, and we'll be back here tomorrow afternoon at 3:30 with the next briefing. Thank you and have a good evening.